to update the Victorian community as to where we are in the current outbreak. I've been joined by the Commander of the COVID response and the Chief Health Officer, and we'd like to share the following with the Victorian people. We have been notified through the Department of Health of 19 new cases, all that are linked to the current outbreak from yesterday. All new cases are primary close contacts identified by the department. 18 were infectious in the community for a period of time, and 1 was isolating the entire period of time. And of those 18, it's an average of 1.7 days of their infectious period in the community, and that figure is a vindication of the going hard and going early strategy that the public health team have put to the government. That takes us to 43 positive cases, all linked to the 2 Sydney incursions. We now have more than 160 exposure sites, and we have around 10,000 primary close contacts and many more secondary close contacts, and all of those figures continue to change rapidly. And my strongest advice is to all Victorians is to check the exposure site list on the Department of Health website and make sure that if you've been near those or you have been there, please get yourself tested. If you're in any doubt, get yourself tested. In regards to those 19 cases, I'll just briefly go through those, and Jerome will go through them in more detail. Firstly, we have an additional case at the MCG in level 2 of the MCC Members Reserve. 2 of his friends have the virus, and they have recently travelled to Phillip Island. That's 3. A social contact of the Trinity grammar teacher at the MCG now has the virus, and we've learned about 2 further staff members at Trinity Grammar also testing positive. So that's 6. There's been a visit to Miss Frankie's restaurant in Cremone from a positive case that has seen 3 cases of transmission with a staff member and a patron sitting on nearby tables. So that's 9. There's also been another student at St Patrick's Primary School in Murrumbina, and that brings us to 10. We also have 2 staff members from Bacchus Marsh Grammar and 1 student. That brings us to 13. And we have 4 household contacts of the Young and Jackson's case, being the gentleman's wife and his 3 daughters, and the partner of 1 of the daughters. That brings us to 18. And 1 household contact of the original gentleman from the city of Hume who visited Coles. This was the case who had been isolating throughout their infectious period and had no either exposure sites or other contacts. So all of that brings us to the 19 new cases today, and both the Chief Health Officer and the COVID Commander will provide more detailed summaries of the outbreaks shortly. Our public health team is responding quicker than they ever have before because this virus is moving quicker than it ever has before. They identify not only those infected, but those who may have come in contact and the next possible multiple layers of contacts after that. On average, each case, as I indicated earlier, has spent less than 2 infectious days in the community. And that measure is really important because it shows the value of going hard and going early to make sure that we get our arms around this as quickly as we possibly can. What it also means is that our number of both primary and secondary contacts is going to continue to grow whilst we run these cases down. Testing numbers have been very high, and can I thank the more than 47,000 people who came forward to get tested yesterday. It is the most important thing we can do in a low vaccination environment to make sure that we give our public health team all the tools and all the support they need and give you the reassurance you need that Victorians are doing the right thing and responding in the right way, which we know they are. Our public health team have also been having excellent cooperation in all the interviews with our positive cases and others, and those are helping us get those exposure sites and other contacts material out as quickly as we possibly can. They are all working from the data that is then corresponded to data check-ins and through tests. So again, not that it applies at the moment, but even if you're out for those 5 reasons that you are out in the community, please make sure that you QR code when you are out for those reasons. And on the basis of all of that, that testing data, that short infectious period of time that so far people are out in the community for, and the clear work that's been done by our contact tracers, all the cases are clearly linked. And the fact that we are going to people to get them tested and then they're coming back is a positive sign. There's no such thing as a good infection, but what we're yet to see is any unlinked, unexpected infections. All of which makes it clear that this lockdown was needed. We won't be taking any chances by not acting on the information that we have. If we get the information to move and to move fast and hard, then that is precisely what we do. And we've gone hard and we've gone early to make sure that this lockdown is as short as possible. We'll continue to assess our progress on this front, be it both metropolitan Melbourne and regional Victoria, as the data continues to come in over coming days. So can I thank all Victorians for your help and the sacrifices that we are all making to make sure that we keep each other, our families and our state safe from the virus. All Victorians are doing their bit by locking down and locking down hard, and we are making sure that the red zone permit holders from New South Wales and the ACT who have entered Victoria, and the people who are now required to isolate as personal close contacts of known positive cases, are doing the right thing. We've also introduced, as the Premier indicated yesterday, new measures to protect our borders against future interstate incursions, particularly from New South Wales. We've tightened the criteria attached to freight and specified worker permits to manage the risks of those required to travel between New South Wales and Victoria in the very, very limited circumstances that now apply. The freight movements and the movements of medical specialists and others that need to happen with the right restrictions in place. From 11:59 p.m. last night, freight drivers are now required to test every 3 days, and a letter will be required from your employer to confirm the specified worker eligibility arrangements. The updated criteria blocks removalists who have been in a red zone or delivery drivers that have been in a red zone within the last 14 days. It also blocks freight workers who are unable to unload cargo in a COVID-safe manner from entering Victoria at all. For example, if they are unable to avoid contact with other people or are unable to enter residential and are unable to avoid entering residential premises. We know these are tough measures, and I want to thank the freight industry for the realistic manner in which they have partnered with the government to make sure that they are implemented. We've seen what the New South Wales interstate incursions can lead to, and this virus does make no exceptions for interstate travellers. We are all living the implications of that right now, and that's why we are taking all the necessary steps we need to and will continue to reduce the risks that Victorians are confronting. Finally, if I can just reiterate, the most important thing that Victorians need to do today to assist us to stay and to get in front of this virus is to check those exposure site lists, which are consistently updated as more data comes in. On the Department of Health website, coronavirus.vic.gov.au, check those sites. If you've been there, get yourself tested. Jerome will go through the expanded testing arrangements that are in place. We saw more than 47,000 people come through yesterday. If you've been there or if you're not certain, get yourself tested. It's the most important message that we can leave Victorians with today. I'll hand over to the COVID Commander to run through the outbreaks and public health response, and then we'll hear from the Chief Health Officer, and then we're happy to take questions. Thanks.